Hello my dear students, good morning, welcome back to my YouTube channel. This is me again, Teacher Tin, your science teacher for today. If you are new to this channel, don't forget to subscribe, like, and hit the notification bell for more updates in Science 8. In today's lesson vlog, we're going to discuss and explain how diseases of digestive system can be treated, detected, and prevented. So may ilan na mga common diseases na maaring binabaliwala lang natin pero pwede pala itong maging serious disease na. The most essential learning competency for this topic is to explain how diseases of the digestive system are prevented, detected, and treated. And for the objectives, these are to identify the different diseases of digestive system, distinguish the symptoms and treatment of these diseases. Diseases of digestive system. The GERD, diarrhea, colorectal cancer. These are some examples of gastrointestinal diseases. When examined, some diseases show nothing wrong with the GI tract, but there are still symptoms. Other diseases have symptoms, and there are also visible irregularities in the GI tract. Most gastrointestinal diseases can be prevented and/or treated. What are gastrointestinal diseases? Gastrointestinal diseases affect the gastrointestinal tract or the GI tract from the mouth to the anus. And there are two types of gastrointestinal tract disease. This is the functional and the other one is structural. Some examples include nausea and vomiting, food poisoning, lactose intolerance, and even diarrhea. Functional diseases are those in which the GI tract looks normal when examined, but doesn't move properly, and they are the most common problems affecting the GI tract, including the colon and the rectum. Constipation, irritable bowel movement, the IBS, nausea, food poisoning, gas, bloating, GERD, and diarrhea are the common examples. Many factors may upset your GI tract and its motility or ability to keep moving, including eating a diet low in fiber, not getting enough exercise, traveling or other changes in routine, eating large amounts of dairy products, stress, resisting the urge to have a bowel movement, possibly because of hemorrhoids, overusing anti-diarrheal medications that over time weaken the bowel muscle movements called motility, taking antacid medicines containing calcium or aluminum, taking certain medicines, especially antidepressants, iron pills, and strong pain medicines such as narcotics, and of course, pregnancy. Now, let us have the structural gastrointestinal diseases. Structural gastrointestinal diseases are those where your bowel looks abnormal upon examination and also doesn't work properly. Sometimes, the structural abnormality needs to be removed surgically. Common examples of structural gastrointestinal diseases are strictures, stenosis, hemorrhoids, diverticular disease, colon polyps, colon cancer, and inflammatory bowel disease. So let us talk about constipation. Constipation, which is a functional problem, makes it hard for you to have a bowel movement or pass stools. The stools are infrequent, less than 3 times a week, or incomplete. Constipation is usually caused by inadequate roughage or fiber in your diet or a disruption of your regular routine or diet. Constipation causes you to strain during a bowel movement, and it may cause small, hard stools and sometimes anal problems such as fissures and hemorrhoids. Constipation is rarely a sign that you have a more serious medical condition. You can treat your constipation by increasing the amount of fiber and water to your diet, exercising regularly, and increasing the intensity of your exercises as tolerated. Moving your bowels when you have the urge or resisting the urge causes constipation. And next one, we have the irritable bowel syndrome. And what are the causes? Colic pain, distension, bowel habit changes, nausea, upper abdominal pain, and pain worsened by food and stress. IBS is also known as spastic colon, irritable colon, IBS, or nervous stomach. And it is a functional condition where your colon muscle contracts more or less often than normal. Certain foods, medicines, and emotional stress are some factors that can trigger IBS. Symptoms of the IBS include abdominal pain and cramps, excess gas, bloating, change in bowel habits such as harder, looser, or more urgent stools than normal, alternating constipation and diarrhea. Alternating constipation and diarrhea. And what are the treatments? Avoiding excessive caffeine, increasing fiber in your diet, monitoring which foods trigger your IBS, so avoid these foods, and minimizing stress or learning different ways to cope with stress, taking medicines as prescribed by your healthcare provider, avoiding dehydration and hydrating well throughout the day, and of course, getting high quality rest sleep. Hemorrhoids. Hemorrhoids is another disease of our digestive system, and we can find it in our rectum or anus. Hemorrhoids are dilated veins in the anal canal, structural disease. They are swollen blood vessels that line your anal opening. They are caused by chronic excess pressure from straining during a bowel movement, persistent diarrhea, or pregnancy. And there are two types of hemorrhoids, the internal hemorrhoids and the external hemorrhoids. As you can see in this picture, this is the internal, which can be found inside your rectum. However, the external hemorrhoid, it can be found outside the anus. Internal hemorrhoids are blood vessels on the inside of your anal opening. When they fall down into the anus as a result of straining, they become irritated and to start to bleed. Ultimately, internal hemorrhoids can fall down enough to prolapse, sink, or stick out of the anus. However, treatment includes improving your bowel habits such as avoiding constipation, not straining during bowel movements, and moving your bowels when you have the urge. And of course, your healthcare provider using ligating bands to eliminate the vessels. Your healthcare provider removing them surgically? Yes, surgery is needed only for a small number of people with very large, painful, and persistent hemorrhoids. However, we have the external hemorrhoid. External hemorrhoids are veins that lie just under the skin of the outside of the anus. Sometimes, after straining, the external hemorrhoidal veins burst and the blood clots form under the skin. This very painful condition is called a pile. Treatment includes removing the clot and vein under the local anesthesia and or removing the hemorrhoid itself. Next, we have the anal fissure. Anal fissures are also a structural disease. They are splits or cracks in the lining of your anal opening. The most common cause of an anal fissure is the passage of very hard or watery stools. The crack in the anal lining exposes the underlying muscles that control the passage of stool through the anus and out of the body. anal fissure is one of the most painful problems because the exposed muscles become irritated from exposure to stool or air and leads to intense burning pain, bleeding, or spasm after bowel movements. So this is the anal fissure, which can be found in your anal opening. And treatment. Initial treatment for anal fissures includes pain medicine, dietary fiber to reduce the occurrence of large, bulky stools, and sitz baths, sitting in a few inches of warm water. If these treatments don't relieve your pain, surgery might be needed to repair the sphincter muscle. And another one, this is somehow, it's the same with the anal fissure. Okay, this is the anal fissure, which can be found also in your anal canal or the anal canal. Anal fistula, again, a structural disease, often follows drainage of an abscess, and it is an abnormal tube like passageway from the anal canal to a hole in the skin near the opening of your anus. Anal fistula, body waste traveling through your anal canal are diverted through this tiny channel and out through the skin, causing itching and irritation. Fistulas also cause drainage, pain, and bleeding. They rarely heal by themselves and usually need surgery to drain the abscess and close off the fistula. And we also have this colon polyps and cancer. This is also known as colorectal colon cancer. Colorectal cancer occurs when the cells that line the colon or the rectum become abnormal and grow out of control. Because symptoms often do not appear until the cancer has advanced, it is important to have regular colorectal cancer screenings. Yeah, this is the colon cancer and the polyp. Each year, 130,000 Americans are diagnosed with colorectal cancer, the second most common form of cancer in the United States. Fortunately, with advances in early detection and treatment, colorectal cancer is one of the most curable forms of the disease. By using a variety of screening tests, it is possible to prevent, detect, and treat the disease long before symptoms appear. How does colon cancer develop? Colon cancer develops when the cell in polyps begin to grow uncontrollably. So this is the normal colon. This is the picture of a polyp, and this one is the colon cancer. See the difference. Stage 0, stage 1, this is stage 2, stage 3. Early detection is the best chance for cure. Most cases of colorectal cancer are detected in one of the 4 ways. First, by screening people at average risk for colorectal cancer beginning at age 45. By screening people at higher risk for colorectal cancer, for example, those with a family history or a personal history of colon polyps or cancer. Next, by investigating the bowel in patients with symptoms. And number 4, a chance finding at a routine checkup. Next, we have colitis. Colitis is a chronic digestive disease characterized by inflammation of the inner lining of the colon. Infection, loss of blood supply in the colon, inflammatory bowel disease (IBD), and invasion of the colon wall with collagen or lymphocytic white blood cells are all possible causes of an inflamed colon. And there are several types of colitis, which are conditions that cause an inflammation of bowel, and these include infectious colitis, ulcerative colitis, the cause is unknown. There is also a Crohn's disease, another example or another type of colitis is ischemic colitis, which is caused by not enough blood going to the colon. And the other one is radiation colitis, and this is caused after radiotherapy. Can gastrointestinal diseases be prevented? Many diseases of the colon and rectum can be prevented or minimized by maintaining a healthy lifestyle, practicing good bowel habits, and getting screened for cancer. And we have here colonoscopy. Colonoscopy is an exam used to detect changes of abnormalities in the large intestine or colon and rectum. During colonoscopy, a long, flexible tube or colonoscope. Colonoscopy or coloscopy is the endoscopic examination of the large bowel and the distal part of the small bowel with a CCD camera or a fiber optic camera on a flexible tube passed through the anus. A tiny video camera at the tip of the tube allows the doctor to view the inside of the entire colon. Many diseases of the colon and rectum can be prevented or minimized by maintaining a healthy lifestyle, practicing good bowel habits, and getting screened for cancer. If you have symptoms of colorectal cancer, you should consult your healthcare provider right away. And the common symptoms include a change in normal bowel habits, blood on or in the stool that is either bright or dark, unusual abdominal or gas pains, very narrow stool, a feeling that the bowel has not emptied completely after passing stool, unexplained weight loss, fatigue, and anemia or low blood count. What are the other types of gastrointestinal diseases? There are many other gastrointestinal diseases, and some of these are the following. We have the peptic ulcer disease. A peptic ulcer disease is a condition in which painful sores or ulcers develop in the lining of the stomach and first part of the small intestine. Normally, a thick layer of mucus protects the stomach lining from the effect of its digestive juices. Another one is the gastritis. Gastritis is a general term for a group of conditions with one thing in common: inflammation of the lining of the stomach. The inflammation of gastritis is most often the result of infection with the same bacterium that causes most stomach ulcers. And we also have the gastroenteritis. Gastroenteritis is an inflammation of the lining of the intestines caused by a virus, bacteria, or parasites. Viral gastroenteritis is the second most common illness in the US. The cause is often a norovirus infection, and it spreads through contaminated food or water or by contact with an infected person. Another one is the celiac disease. Celiac disease is an immune disease in which people can't eat gluten because it will damage their small intestine. If you have celiac disease and eat foods with gluten, your immune system responds by damaging the small intestine. Gluten is a protein found in wheat, rye, and barley. Next is gallstone. Gallstones are pieces of solid material that form in your gallbladder, a small organ under your liver. If you have them, you might hear your doctor say, "You have colitis." Your gallbladder stores and releases bile, a fluid made in your liver to help in digestion. The next one is appendicitis. Appendicitis is an inflammation of the appendix, a finger-shaped pouch that projects from your colon on your lower right side of your abdomen. Appendicitis causes pain in your lower right abdomen. However, in most people, pain begins around the navel and then moves. Next is we have dyspepsia, or this is also known as indigestion. It refers to discomfort or pain that occurs in the upper abdomen, often after eating or drinking, and it is not disease but a symptom. Dyspepsia is a common problem affecting up to 30% of the population. Common symptoms include bloating, discomfort, feeling too full, nausea, and gas. Next, we have pancreatitis. It is a pathologic inflammation of the pancreas. Your pancreas sits behind your stomach, near your small intestine. It releases enzymes that help you digest food and also regulates how your body manages glucose. Short bowel syndrome, SBS, or simply short gut, is a malabsorption disorder caused by a lack of functional small intestine. The primary symptom is diarrhea, which can result in dehydration, malnutrition, and weight loss. And we also have the next one is the Whipple's disease. Whipple disease is a rare bacterial infection that most often affects your joints and digestive system. Whipple disease interferes with normal digestion by impairing the breakdown of foods and hampering your body's ability to absorb nutrients such as fats and carbohydrates. The next one is the Zollinger-Ellison syndrome. It is a rare digestive disorder that results in too much gastric acid. This excess gastric acid can cause peptic ulcers in your stomach and intestine. Symptoms include abdominal pain, nausea, vomiting, weight loss, and diarrhea. If left untreated, there can be serious complications. And we also have hepatitis. This is an inflammation of the liver. Inflammation is swelling that happens when tissues of the body are injured or infected. It can damage your liver. This swelling and damage can affect how well your liver functions. Hepatitis can be acute, short-term infection, or chronic or long-term infection. This is the end of our lesson vlog. In today's lesson about the different ailments and diseases in the digestive system. I hope you learned something from this vlog. See you on my next vlog, and next time pag-usapan naman natin ang how enzymes affect digestion. Thank you and goodbye. See you on my next vlog. This is me again, Teacher Tin, your science teacher. If you are new to this channel, don't forget to subscribe, like, and hit the notification bell for more updates in Science 8. Bye! Oy, subscribe ka muna!